2026. Today's session continues our journey of learning by bringing together experts to share their knowledge and experience in equine veterinary medicine. To formally commence today's program, I would like to invite our organizing secretary, Dr. Kritika Dial, ma'am, to deliver the opening remarks. Over to you, ma'am.
Thank you, Siddhant. So, a very good evening to everyone. So, before we begin this session of Equine Summit 2026, I would like to extend a warm welcome and heartfelt welcome to our esteemed speaker of the day of today's session, Dr. Adarsh Kumar, sir, who is an eminent surgeon, a pioneer in his field, an inspiring mentor who have guided a number of students, number of professionals through his career. So we are truly grateful to have you with us today, and it is an honor to us to have you share your inspiring knowledge and experience with us. So we all welcome you here today.
Thank you.
Also, I would like to welcome our participants, researchers, professors, and students who have joined us from all over the India, from the different parts of India. So I welcome you all. So with this, I would not be taking much time. So I think we should proceed further. So once again, thank you and have a wonderful session.
Thank you, ma'am, for your inspiring words. To provide a brief overview of today's session, I would like to now invite my co-host Tejaswini. Over to Tejaswini.
Thank you, Siddhant. Welcome back, everyone. It's day 2 of the ISSCFW Equine Summit 2026. Today, we have the privilege of learning from one of the most respected veterinary surgeon and academician in the country. It is now my privilege to introduce our esteemed speaker, Dr. Adarsh Kumar. Dr. Adarsh Kumar is the professor of surgery and head of the teaching veterinary clinic complex at the Veterinary College, Palampur, with over 28 years of experience in veterinary education, clinical practice, and research. His expertise include anesthesia and critical care, diagnostic imaging, dentistry, soft tissue surgery, and equine clinical practice. He has also served as the visiting professor at the University of Tripoli, Libya, and is the innovator of the Admit Pen, a widely used orthopedic implant in veterinary surgery. A fellow of the National Academy of Veterinary Sciences and a recipient of numerous prestigious awards, Dr. Kumar is widely respected for his contribution to veterinary medicine and education. It is a great honor to have you with us today, sir. We warmly welcome you and request you to kindly begin your session.
Thank you, Tejaswini. Thank you, Kritika and Siddhant. Am I audible?
Yes, sir.
Am I audible?
Yes, sir, you are audible.
Okay, fine. So thanks for having me here, and I'll not waste the time. I'll start with the presentation here. So can you see my presentation?
Yes, sir.
Oh, okay, fine. So today's topic is, which has been assigned to me, was the clinical protocols and procedural techniques in equine general anesthesia. And we'll begin from the beginning here. Okay. Oh, can you find the difference between these two pictures? Okay. So the one picture is of a sailing ship. This one, if you see my cursor. Okay. The other picture is of a ship within troubled waters. Right. So this is a sailing ship and it's a sinking ship. A surgeon is a captain of a sailing ship, whereas anesthetist is a captain of a sinking ship. So with this picture, you can very well guess that how much of the maneuvers the anesthetic would be requiring in the OT or in the operation theater or even in the field when they are doing the anesthesia. Okay, so begin from here. One thing you must understand that anesthesia is a poison, right? You're giving something which is a kind of a poison. If it goes a little high, So you start from the sedative, neuroleptic, then sedative become hypnotic. When you increase, it becomes narcotic. When you increase the dose, it becomes anesthetic. And then there is no watertight compartment between the anesthetic and the euthanasia. So remember that you are giving a drug which is modifying the CNS, which is depressing the CNS, which is considered to be a poison. But then, as an informed veterinarian, you should know that how much it is to be used and when it is to be stopped. That is very, very important. Okay. So in the field, extending surgery or anesthesia unnecessarily is unethical when it comes to the horses, I tell you, right? Because whatever we are doing, we should finish the job as early as possible. Because the drug which we are giving at the cost of the animal. Animal has to biotransform it, titrate it, eliminate it. Let's not burden the animal in eliminating the drug. That's the first thing you should always be considering. Now, why equine anesthesia is important when you compare with the small anesthesia in the anesthesia? So, in equine anesthesia, the mortality rate is 1 in 100. In small animals, it is 1 in thousands. In humans, it is 1 in 2 lakh. So look at this bracket. When you anesthetize 100 equines, they can be single mortality, which should be always taken into the consideration. Well, and this ratio haven't changed from last 30 years. It's remained same. So that means it is writing on the wall that this is the risk ratio when you're dealing with the equines. Fine. And most common cause of the death is the pronounced cardiovascular depression, as compared to the dogs and cats. So cardiovascular depression is one of the most common reason of the mortality in the equines. Always remember that. So when you talk of the key components of the anesthesia, right? Can be hypnosis. It should be, muscle should be relaxed. Then there should be suppression of the stress, and there should be analgesia. Because as equines, they are considered to be stress free. Otherwise, if they are under stress, your induction is a problem, your maintenance is a problem, and recovery is a problem. Okay. So why anesthetic problem occurs? Human error is 55 to 60%. Equipment and facilities 5%. Anesthetic drugs 5%. Surgery 15%. Species 25%. So all in all, human error is responsible for most of the problems which is occurring in the equine anesthesia. So there are no safe anesthetic drugs, no safe anesthetic techniques. They're only safe anesthetics. You should always be keeping in mind. This is, you might be knowing that this is a body weight estimation, and for your ease, this formula you might be reading in second year in LPN course. If it is an adult, it has to be divided by 330. For yearling, it has to be divided by 280. And whatever measurements you are taking, you can take it in inches also. I've given in the centimeters. Okay. So this is how the girth is calculated, and this is the length front, starting from the point of the shoulder to the pain point, and girth is all around the body, just behind the elbow joint. Now, when it comes to preoperative preparation, you should always be keeping in mind that access to water should be allowed up to pre-medication. Remember, there are two things. One is off feed and another is off water. So you're not going to keep the equine off water. Equine is a very athletic animals. The muscles are very supple. They contain a lot of water. They contain a lot of juice. So they shouldn't be dehydrated. So there is no point in restricting the water as well as feed. There's no point in restricting the water. Feed should be restricted for 4 to 6 hours before the pre-medication. But if you keep both the feed and the water off for 4 to 6 hours, you will end up with the animal having dehydration. You have to stabilize the animal and then you have to induce. Mind it. So they do not vomit. So there is no question of regurgitation in case of the equines. Of course, to prevent the rupture of the stomach, we need off feed for 4 to 6 hours. Shoes should be removed. A tail bandage is to be applied. Then mouth is to be rinsed because horses are in habit of eating. Even induction, if you're doing in an open field, they will be picking up, browsing the, grass and all. So once you knock down the animal, you induce the animal, the first thing you're going to, do is rinse it. Or even before induction, you should be rinsing, that is a point which should be considered. Then IV catheter should be in place because you need a patent IV line for giving the drugs. Then padded head collar is very, very important. You should always choose a grass paddock or you choose a mattress to just avoid the injury to the superficial nerves of the head, of the shoulder, and the other regions. Some of the brief physicals you should be you're watching before the anesthesia. When it talks of respiratory, you should be noting the effort and the rate. Just have a palpation of the normal trachea, right? Just to know that how much of a size of the ET should be going inside. Then audible upper airway noise if present, nasal discharge if present. Eyes should be bright, should not be dull, it should be clear, not cloudy. Heart ka pulse quality, discharge, eyes, nose should be writing down on the paper, enlarged lymph nodes, superficial lymph nodes. Then hair coat, it depends upon the season, whether it is sleek or it is rough, has to be kept in mind because you should be anesthetizing the animal which is apparently looking good to be anesthetized. Okay, it should not be in LMC. LMC is a low medical category. Now, this is the ET, how it is being carried out. It is carried out by blind method. This should not be direction of your ET. Your direction of ET should be like this, right? So you should not be forcing anything. In biological system, should not force anything. If it is not going, that means it is not going. Should not force. It should go smooth and fit smooth. You have to check the cuff before, you put for the leaks and all. Apply a copious KY jelly for lubrication of the tube, and mouth gag is always useful because it allows the mouth to open and then you can put your hand inside along with the ET tube. And this is how it should be. The trachea, the oropharynx, the ostium of the trachea should be looking like, should always palpate it. So esophagus is collapsed. If it is going in the esophagus, you will find a resistance. If it is going in the trachea, you won't find any resistance. And this is the ET size tube I've given for various slots, 70 to 100, 150, 250, 350, and 450 kg. And this table should always be there and pasted on the wall in your hospital. Now, when you choose the anesthetic protocols, obviously you have to consider the availability of the drugs and then the benefit of the drugs you are using. Then you must be having one note on the patient behavior also. The temperament is high or it is subdued or it is okay. Then you should be knowing the potential adverse effect of the drugs you are using, recovery, and the systemic signs of the drug, which drug can produce in the dogs. Of course, cost is another limiting factor in choosing the anesthetic protocols. Now, here, remember, my friends, if you start from mule require most anesthetic. I mean, the quantity of or the dosage of the anesthetic is highest in the mule, then the pony and donkey and the horse. The horse require least anesthetic agent or least of its dosage. Right. Remember this engraved in your mind. Some of the other factors which affect the anesthetic requirement is the patient temperament and the level of training. If the horse is highly trained or is not trained, then level of excitement or stimulation prior to sedation. It is always a truth, Then the breed, age, health status, patient position during surgery, lateral में है या dorsal में surgery कर रहे हैं. Right. Then other factors affecting the anesthetic requirement, the patient temperament and level of training. Okay. Now, sorry. patient temperament and level of training. If more training is there, less anesthetic is required. If less training is there, more anesthetic is required. So just look at this. Level of excitement prior to sedation. If it is more excited, you require more anesthesia. If it is less excited, you require less anesthesia. Why you require more anesthesia in the excited animals? Because the blood is diverted towards the muscles and the skin because of the fear flight mechanism. Whatever drug you are giving by intravenous route, it will go into the vascular tree, will be trapped in the resistance vessels of the skin and muscles, and that level across the CNS would not be maintained. So that means that anesthetic dosage will increase. But once you anesthetize them, you will always find a prolonged prolonged sleeping time. So that is also not desirable. Age, geriatrics, as the age goes up, it requires more anesthesia. So just a point here, benzodiazepine should always be considered in the geriatrics. When I talk of benzodiazepines, that means the Campos or midazolam. Breeds with thoroughbred, they require more anesthesia. Draft horses, they require less anesthetics. Almost 15% is less. Miniature donkeys, they also require less anesthetics. Health status, obviously, you have to always keep in mind. So patient position during surgery also affect the anesthetic requirement. If the animal is to be operated for the colic, let's say in the dorsal recumbency, you require more anesthetic. If it is in lateral recumbency, you require less anesthetic. And one thing you should always be keeping in mind, I've written in red, that surgery staff should not lean, lie, or sit on the patient abdomen unless surgery cannot be performed without doing so. So you are not there to catch hold of the animal and leaning on the animal, putting pressure on the abdomen. No, abdomen and thorax should be free in the movement. You can very well, foresee, and you can very well judge that when the animal is in the lateral recumbency, the lungs which are touching the ground or the recumbent lungs, they hardly work 60%. In the dorsal recumbency, all the viscera is compressing the organs. The diaphragm is compromised. So that means already his animal is experiencing, a respiratory or air hunger. So your body weight should not, make the animal to slip into a compromised position. Then the recovery quality is very important. So increase anesthesia or length of the anesthesia is equal to the potential decreased quality of the recovery. That's why I've told you that don't increase the length of anesthesia. If your length of anesthesia is increasing, you will always find a decreased quality of the recovery. Right. So patient temperament and level of training, as I already expected, excitement, breed or gated horses, geriatric animals, then the surgery you undertook. Orthopedic surgeries are more painful than the vessel surgeries. Patient position during surgery, lateral or the dorsal, and quality of anesthesia. This all will affect the recovery quality. Then strategies to mitigate the poor recovery quality. That means what has to be done pre-op. Now here, the point should always be kept in mind that please do not isolate the horse from a group. You have to sedate that horse or that equid in the group. Suppose a pack of mule is there or a pack of horses is there and you want to castrate 4 horses out of 6, isolate one. The isolation will create a stress, will create anxiety, and will create a trouble in the anesthesia. So don't separate them from their friend. And amongst all, sedate the less nervous patient first and sedate more nervous patient in the last. Because if in a pack of 6, you are choosing the animal which is the most exciting, we always say, when your duty is to eat frogs, 2 frogs a day, then you should be eating a larger frog first and the smaller dog and the smaller frog later. Here, choose a less anxious animal first and or and most nervous patient later, because most nervous patient को आपने choose कर लिया तो वो सबको nervous करता है, right? Then the patient temperament and level of training. Do not fight with the patient, I tell you. Don't make an ego with the animal. You'll always be a loser. Okay, don't fight with them. And fight will induce excitation. So do not excite the patient. Then breed, draft horses, they require less sedative dose, always keeping. So when you are giving, you have already given the anesthesia intraoperatively. If you find that the level of pain would be high, you can always combine your general anesthesia with the appropriate local nerve block. For example, the regional nerve blocks, which are used in the dogs, right? Then you should always administer the anti-inflammatory medication intraoperatively. That will also mitigate the pain. Or you can use epidural also, analgesic epidural, during the intraoperative period. Then don't place the patient in the dorsal recumbency unless it is necessary, right? If the surgeon cares about the patient, he will always be avoiding the recumbency, which can delay the recovery quality. Keep in mind. So if your job is done in the dorsal recumbency, immediately or slowly you can shift the animal into the recumbency just to avoid the complications of the dorsal recumbency, putting a lot of pressure on the caudal vena cava, diaphragm, as well as the aorta. Then post-operatively, I tell you, it is very, very important. There's a term we always say in the anesthesia: don't chase the anesthetic depth. Chase the anesthetic depth means that don't wait for the animal to show or come back into a light plane of the recovery or light plane of the anesthesia. And then, it is coming back. You again give the anesthesia. So this is known as chasing the anesthetic depth. Don't chase. If you chase the anesthetic depth, your recovery will always be very, very poor quality. Okay. Monitor the animal and keep on giving the drugs, or if you're maintaining on a triple drip or a double drip, you have to don't let the animal come in the light plane of the anesthesia. It will worsen the recovery. Okay, so how to reduce and avoid the post-operative stimulation? Keep the eye covered until stand on their own. Eyes ko cover rakhiye. Use Xalazine post-operative 10 to 20, even 25% of the initial sedation dose. That will take care of the excitation of the recovery. If ketamine is showing muscle rigidity, you can give the Xalazine. That will get rid of the muscular rigidity. Maintain silence and total lack of activity around the patient. No disturbance. Flies are a biggest problem when you're doing the anesthesia in the field or in the open. Apply the fly spray if necessary. Do not disturb the patient. Allow patient to sleep it off. Geriatrics, injured of weak animals, they may be very weak in hind end. So you can always use the tail assisted recovery. That means when the animal is making an attempt to stand up, please assist them with the tail so that you can make them stand. Okay. Then some of the availability issues in the Indian scenario, I think Xalazine is available to you, ketamine is available to you, diazepam and mids is available to you, guaifenesin is available, and butalphenol is available. So I will talk mainly about the drugs which are available for you in the field. So Xalazine is an alpha-2 adrenergic agonist. You know that. Benefits of Xalazine: it produces sedation, analgesia, and it is short-acting. The adverse effect is on the GI. Gastric emptying is, compromised, and the bolus transit in the intestine is compromised. Blood pressure, it lowers the blood pressure. A recovery sometime, it causes a kind of a emergency delirium. The patient remains subdued and depressed for a longer period of time. Butorphanol is a opiate partial agonist, and it is used as analgesic, pre-med, antitussive, and antiemetic. This is one of my very favorite drug in the horse anesthesia. Benefits, it potentiate the alpha 2s. That means that when you're using butorphanol, you decrease the dose of xarelto, of ditomedine or the medetomidine, right? You require less volume. So it analgesia. So there's always a saying, when you have given the xylazine, don't stand very near to the patient, to the equine patient. It can kick. But if you have given butorphanol along with the xylazine, that plants the hind limb, so the hind limb kicking is avoided. It prevents the kicking. So butorphanol is very good in planting the hind limb. Adverse effect, again, GI emptying is compromised. Unwanted forward impulsion. Sometimes the animal start walking and there is a head bobbing, like torb twitches, we say torb twitches. The animal, keep on bobbing the head like this, right? So if the animal is doing it for even the recovery period, you can always say they are torb twitches, and they are there as long as the effect of butorphanol exists. Then diazepam and the meds. So both are sisters, a big sister and a small sister. Benefit is excellent. That is the muscle relaxation, and it decreases the anesthesia time. Right. When you talk of the donkey mule anesthesia, it stands, or it makes a niche for it. It has a place for it. It prevents excitation, occasionally seen sometimes with the xylazine. So immediately after giving the xylazine, you can give compose. It prevents the patient from being startled prior to induction. No? If you want to induce the animal and there is a problem of it being disturbed, you can give compose. Then it allows for early inductions in very difficult animals. In geriatric animal and in difficult animal, compose or midazolam or benzodiazepines, it modifies the behavior. So a note to remember that benzodiazepine should be in your bag, should be in your kit when you are anesthetizing geriatrics, donkeys, mules. Procedures require the dorsal recumbency. Then the ketamine benefits, it is a dissociative anesthesia. That means the head is knowing, but rest of the body is dissociated. It is not knowing what is happening in the body. Then it provides some analgesia. Adverse effect are recovery time is one, the recovery quality, because of it being a cataleptoid anesthesia. It sometimes produces the rigidity of the muscles. Always keep in mind. And whenever there is a rigidity of the muscles, the recovery is a problematic thing. Then you can give either diazepam or ketamine or xylazine to get rid of this rigidity. And if you are increasing the dose, the effects are cumulative. GG or guaifenesin. It is again a parenteral muscle relaxant, and it is also used as an oral expectorant. The benefits are muscle relaxation, excellent. Adverse effect, if it goes perivascular, it is highly irritating. Then weakness during recovery is seen. Animal looks frail for certain period of time, and that has to be communicated to the client, also the owner of the animal, that it will be subdued for certain period of time. Then because of its concentration, it sometimes produces hemolysis. And donkeys and mules are very sensitive to GG, so use it with a caution. Horses, they very well tolerate the GG. Then another drug, which is my again favorite, is a loxicard, lignocaine. Please do not use the lignocaine which is meant for local purpose. It is loxicard, lignocaine hydrochloride, which is only and only meant for the IV use here. Okay. So intraoperative analgesia without the cardiovascular effect. Now, loxicard or lignocaine has a quinidine-like effect. It stabilizes the membrane of the heart. So any kind of arrhythmia, any kind of problem related to heart would be mitigated, right? Then recovery improves due to decreased pain. effect is 24-hour post-op. And there is a prevention of pain. Prevention of pain means wind up. Wind up means that the pain is for certain period of time and then it abolishes and then again it comes, then again it comes, then again it comes, and you feel for certain period of time equine is okay. And then the next minute there is again a pain. The next minute animal is okay. The next minute and again is pain. So if you give Loxicard, that will wind up the pain. Okay, although the data is lacking, but the dose which we are using here is the 5 milligram per kg lidocaine loading dose and 100 microgram per kg per minute as CRI. It is high dose, or 2.5 milligram per kg lidocaine loading dose and 50 microgram per kg minute as a CRI. That is a low dose. So if you want to give high dose, you can use above 5 milligram. If you want to give low dose, you can use 2.5. So if you say that one protocol fits all, you are wrong. And if you say one rate of administration fits all, you are wrong. So every patient will have a different metabolic rate and their requirement is different. So your judging or judgment will depend upon the monitoring you are doing on the patient and adjusting the anesthetic protocols. One. Then there are absolute numbers like 1.1 milligram of the ketamine, 2.2 milligram of the ketamine. You can adjust according to individual need of the patient. You should not stick to the numbers. These numbers are for the beginning. That's why the range is very high in case of the anesthetic agents. So the anesthetic protocol, sedation and induction, most basic protocol, which is one of my favorite also I'm using from long time, is 1.1 milligram per kg xylazine, 2.2 milligram per kg ketamine. I'm not writing the route here. Remember, keep it on your mind engraved till you die that almost all the anesthetic drugs which are used in equines are only used by intravenous route, not by intravascular route or by subcutaneous or any other route. IV, and IV. Okay. Now, if possible, you can add compose, diazepam or midazolam at 0.05 milligram per kg IV and butorphanol 0.02 milligram or 0.02 to 0.04 milligram, right? More important in a difficult animals. So in Indian conditions, what is happening is butorphanol, you're not getting more concentrated per ml. Like in Western countries, you are getting butorphanol, which is very concentrated, let's say 10 milligram per ml. But here, you end up giving more volume of the drug because the concentration of the drug is very less. It is sometimes 2 milligram per ml, sometimes it is 1 milligram per ml. So keep that in mind. These are the anesthetic drugs and range of use. Xylazine, you can use in basic protocol 1 mg, range is 0.5 to 1. Butorphanol 0.02, range is this. Compose 0.03, range is this. Ketamine 2 milligram, you can go up to 2.75 milligram, starting from 1.5 to 2.75 milligram, depending upon your pre-anesthetic assessment of the animal. This is the table. I always keep file this ready according to the body weight, the xylazine, butorphanol, diazepam, and ketamine, which is that can be used. So you need not to calculate the weight always. 165 kilo ye use hoga, 180 kilo. You don't have to use always calculate it. So that is already recognized. This is the expanded anesthetic dose chart for horses, donkey mules, ketamine horses, donkey mules. So that has been already calculated. So look at this. The xylazine has been given. You can see the relaxation of the penis. The head is down and the swing of the. This is a field anesthesia and a ground we are doing. And, this is the swing of the hindquarters, relaxed penis, and head is down. If you see the induction here, look at the head I'm holding. This is how the head is being, if the horse is high, you can keep the head on your shoulder. If it is a lower horse or miniature horse, you can keep the head on, below your shoulder near the chest. just move it. This is a field anesthesia. I'm just giving a demo here. Now the ketamine has been given after the xylazine, and this is how the animal will be knocked down on the ground. You should not put a casting harness. So one person should always be on the tail, straightening the tail, because when you put pressure on when you pull the tail, when animal falls down, the chances of fracturing the thoracolumbar area is avoided. Then there is a +2 ketamine rule, which should always be kept in mind. Now, if your horse is more than 360 kg for surgery, add 2 ml of calculated ketamine already. That means 2.2 के हिसाब से जो आपने कैलकुलेट किया है, उसमें 2 ml और ऐड कर लीजिए 100 mg per ml if you are doing surgery in lateral recumbency. If you are doing in a dorsal recumbency, add 3 to 4 ml of the calculated ketamine for that animal. If horse is 180 kg, more than 180 kg, then add 1 ml for lateral recumbency, 1.5 to 2 ml for dorsal recumbency. Right? Why I am giving this extra dose than 2.2? I do not want to chase the anesthetic depth. So I am using little higher dose to avoid the chasing of the anesthetic depth. Right. So this is known as +2 ketamine rule or +2 ketamine Cindy rule. Okay. So some of the intractable horses, which are, very wild. So they have tested the xylazine, which is given 5 times the dose, 1.1 milligram per kg का 5 times dose भी दे दी है. उसमें भी animal को कुछ नहीं होता, but some convulsions they are being found, and there is a period of the prolonged sedation in horses. Just a running reference I am giving to you. That doesn't mean you give 5 times of a dose. If it is not, then please abandon the procedure. Okay. So generally, the wild or intractable horses, they require 2 times of the normal dose of the xylazine. That means 2.2 milligram per kg. Earlier, it is the normal dose is 1.1 milligram per kg. Donkeys. So biggest problem people have with the donkey is that donkey को समझा नहीं किसी ने. Lack of understanding of the behavior. See, and unwilling to allow them a donkey movement. Donkey is a very sweet animal. It's a very sweet animal. This animal has its own mind, and it is often been misunderstood. आपको बोलते हैं अब तुम गधा हो. That doesn't mean you are gada, but then gada it has a very unique personality. Donkey behavior is always 101. If you talk of horse, if you intimidate a horse will run away, will avoid the altercation. But if you talk of donkey, they will freeze and they will consider the option. And with head held high, ear attent, they will swish the tail and will come and charge you. So they prefer flight before flight. The horses prefer flight before the fight. So horses feel that, when the horse is surrounded by the vets, horse feel that मैं काफी अकेला हूं. And when donkey is being surrounded by 3-4 vets, so donkey says that I'm अकेला काफी. Okay. So failure to recognize the stress in donkey is also one of the thing. You don't know what is the stress level. So sometime, chasing the patient with the anesthesia again will lead to the poor recovery. So what you are going to do in the donkey is, again, the xylazine sedation by weight is 1.1 milligram per kg. The moment you've given this, you immediately administer compose or meds 0.02 milligram per kg IV. Then induction with ketamine at the 2.7 milligram per kg if it is a quiet situation. If your room is quiet, if your OT is quiet, if your induction room is quiet, but if it is a heavily trafficized area or a stressful situation, then the dose goes as high as 3.6 milligram per kg. Right. So prefer that there should not be much of the dogs around, much of the students around, much of the doctors around. If you want to use a lower dose, the situation, the circumstances, the ecosystem around the donkey should always be quiet. mules. 50% increase in xylogen. You have to increase the dose of xylogen 50% of the usual dose. That is 1.1 milligram per point. So there is an occasional excitatory response to the sedation. So sometime, you give xylogen and you find that instead of getting subdued or showing the head down, it shows some period of the excitation, right? So to avoid this, give benzodiazepine immediately after xylogen. What is the dose? Again, 0.02 milligram per kg body weight IV. जैसे ही आप डायजेपाम देंगे, it may lie down after the benzodiazepine. Then increase in 50% of ketamine also for induction. So 30 to 50 also. So here you're of the ketamine for topping off also, right? And remember that mules, if you are using GG, always keep in mind that the GG, they are mules, they are sensitive to the GG. So you can use the alternative triple dip recipe. Okay. Then how to maintain the. So intermittent bolus of 1/4 or 1/3 of the dose of the initial ketamine mixed with half volume of the xylogen. Okay. 25% of the ketamine which have used initially at the dose rate of 2.2 milligram should be mixed with the half volume of the xylogen you've already used. For example, 0.5 ml xylogen and 1 ml ketamine. Make a syringe. 1 ml xylogen, 2 ml ketamine, 1.5, 3, 2, 4. So depending on the size, you can inject these intermittent bolus to make the animal or to maintain the anesthesia in an excellent stage. Okay. Then comes the anesthetic protocols where we maintain the animal, after induction, this triple dip infusion through administration and set of the catheter is given. You have two protocols here, standard protocol for horses and standard protocol for donkeys and mules. So for standard protocol for horses, 1 liter 5% GG, 1 gram xylogen, 2 gram ketamine mixed. You will mix it and administer at the rate of 2.2 ml per kg per hour, by pediatric drip set. For donkeys, 1 liter 5% GG, 500 milligrams xylogen and 2 grams ketamine administered at 1.5 ml per kg per hour. Adjust the rate as needed for the individual animals. Okay. So standard mix 1, 1, 2. For donkey, standard mix is 1 liter, 500 milligram and 2. Okay. Keep that in mind. This is according to the body weight kgs, how to, set the speed of the drip. Then after induction, you can also give a double drip infusion through a 15 drop per ml administration set. So ketamine and xylogen are added to 250 ml bag of NSS, right? And dose is specific for the size of the patient. Starting rate is 1 drop per second, right? Now, this is how the double drip is being maintained. So for horses, I'm always using a xylogen 100 and ketamine 100 because then the volume is less. Okay. So this is according to weight. The xylogen and ketamine, they are mixed in 250 ml of the NaCl. So you remove 250 ml of the NSS and you mix xylogen and ketamine and you can, give it at 15 drops per ml set with the administration set, right? That is 1 drop per second. 1 drop per second. So that will maintain the anesthesia as long as you want to do. But then propofol also. If you have a propofol, the dose is 0.1 milligram per kg per minute and medetomidine 3.5 microgram per kg per hour combo can be used. It provides a very satisfactory anesthetic plane. Recovery is in the 4 hours. Anesthesia remains very smooth, rapid, and complete. Now, I was talking about maintaining the speed. Now, these are the need of hour. if you're using a pediatric set, it is very difficult to fix the speed of the drip. So these infusion pumps, they cost you some 25,000 to 50,000 rupees. So in your clinic, on your hospital, on your practice, you can always have these infusion pump, and you can use it for multiple purposes, anesthesia of small animals also, anesthesia of large animals also. So the concept of CRI, controlled rate infusion or continuous rate infusion, is in vogue, and manually it is very difficult to maintain that speed which I'm telling you, that 2 ml per kg per hour. So if you fix in the infusion pump, you forget what is being done. The infusion pump will take care of that. So IV anesthesia should not be prolonged beyond 45 minutes in adult horse. If it is exceeding 45 minutes, that means that horse needs the oxygen to breathe. Either enrichment. So if you are using the endotracheal tube, you can have this oxygen concentrator or the cylinder with a pipe inside in the ET tube, right? So 1.5 to 2 liters per minute you can maintain. If you have not, if you have not intubated the animal, then put this light tube of the IV from the oxygen in the nostril of the animal. So whatever animal is breathing, animal is not breathing pure oxygen, but animal is breathing enriched oxygen, enriched air. That means the air enriched with the oxygen. So that also maintains the vital of the patients. We have done one study where we given pure oxygen. There we could see that in the recumbent animal, the SpO2 was somewhere 99. But when we used it without the anesthesia machine, only with the help of the oxygen using a cylinder or oxygen concentrator, it was 97, 98, hardly 2% difference. And always keep in mind. Then if you're using the inhalant anesthesia machines, then you should be knowing the MAC of the ISO and the CO. This is the setup of Palampur, which we are using. We have equine table here and the anesthesia machine with a descending ventilator of the wetland company. So if you're not finding the ketamine, you can use butorphanol 0.02, xylazine 1.1, and zolitol, either 1.1 or 1.25 milligram per kg IV. Okay, look at this. In this animal, the zolitol is being given, and this is how it is being induced. Look at this. This is our induction chamber here. The horse is a spitty horse, and the zolitol is being given at 1.25 milligram per kg body weight. And just see that there is a swaying after, and animal will slowly and slowly is going into a quiet induction here. Look at here, animal is not falling with the pressure, and look at this, how beautifully the animal is being knocked down and induced. Okay. Second combo is xylazine 0.007 ml per kg IV. Then combination of ketamine, zolitol, and ditomidine. This combination is prepared by reconstituting the zolitol, ketamine, and ditomidine. So this is also alternative and second combination which you can use. Foals. Okay, so foals are foals, they're not horses. So first combination is compose 0.1 to 0.2, ketamine 1 to 2, and maintain with the inhalation anesthesia. Second combo is xylazine 0.5 milligram per kg IV, ketamine 1 milligram per kg IV. Maintenance is the inhalation anesthesia. If you don't have the inhalation anesthesia, then ketamine, which is being used initially, can be used. 25% of induction dose can be used for maintenance of the anesthesia, right? But don't maintain it for more period of time, because the younger animals, their oxygen requirement is more. They should not have this oxygen deprivation, which is very, very important for its vitality in recovery. So types of induction, hand is tail assisted is there. You can catch hold of the tail. You can, you can with the hand also you can make the animal not to fall violently, right? Or you can make the animal to go into chute. Okay. So this is a free fall method which normally we are using. We are not using the casting method. Animal will be excited and will have nervous, episode. This is the hydraulic table method. We don't method. I've already shown you as allergen. So swing door method is very good. We are using it. We induce the animal and we close it with the door. As the animal is being knocked down, the door is slowly and slowly released, and animal falls down without the aggression and it is not violent at all. Safety point. So if you don't say safe, you put everyone at risk. Anna. So one person who is not showing a safety will put everyone at risk. So how to stay safe? Stay aware, stay on your toes. टोज पे रखिए, आप पीछे पलाथी मार के मत बैठ जाइए उसके ऊपर साथ में. Okay, should always be on the toes and not on the knees. Stay out of the danger zones. These are the danger zones. It should not be here. Your back should not be towards the anesthetized patient, right? Even in the front, this area has to be avoided. So within 6 feet of the legs of the anesthetized patient should be avoided. So do not stand here between the front and the hind leg.
Sir, can you please unmute yourself?
Yeah, somebody has muted me. I don't know why. Am I audible now?
Yes, sir, you are audible.
Okay. So don't stand here and here. Don't be jingoistic and adventurous. If you stand here or sit here, next day there's a large possibility that you may not be able to brush your teeth. So safety is the avoidance of the very unlikely but very high impact is there. Do not hold the ropes like this. Hold the rope like this, because if you hold the rope like this, animal if stretches the rope, if tries to run, your hand will have a rope. Can you okay. So rope one would be there. So don't fight the process. You wait the horse to fall down. Don't make the animal to fall down with your hands or making a lot of pressure. Don't, just beg the animal to fall down. So attempts to topple the horse, if you're trying to give a dhakka or something like that, do not try that. So this is induction, always choose the first anterior 1/3 of the horse, because the jugular vein is very superficial here. Don't go in the middle and don't go far beyond also. It would be very difficult for you to secure the cannula there also. So waiting adequate time, sedation improves the induction, right? So don't rush to a patient who has gone down fully. Once the patient is down, then you move forward. After induction, a pillow on the head, cover the eye, and give flunixin. This flunixin is very important because it dissipates the pain also, right? And nystagmus also sometimes. So 18 gauge, 1 to 1.5 needle has to be used, and the flush needle 2 ml of the blood should be collected, for some tests or anything like this. After induction, how to check the depth of the anesthesia? Nystagmus should not be there. Eye position should be central and moist. Lacrimation is there, crying. Palpebral slower than normal. Muscle tone. All limbs should be touching the ground. If one limb is above the ground, that means animal is not sedated, not anesthetized properly. All limbs should be touching the ground. Then respiratory pattern should be smooth and even. This is the nystagmus and the eyeball position. Okay. And this is intact palpebral reflex. The animal is coming back to recovery. And don't tap for the palpebral reflex. Sometimes what happens, this get fatigue and you don't find the palpebral reflex. So if you are doing a routine castration and you find nystagmus, eye position is not central, there is no lacrimation, then flunixin, which you have not given, should always be kept in mind, and wait 2 minutes. If still present, then you have to top it off. If you're doing hernia and nystagmus is there, you have to top off with the double prior to rolling into the dorsal recumbency. So nystagmus is very, very important to see whether the animal is in the pure depth of the anesthesia or not. So the most reliable sign after, otherwise every patient is different. So there is lacrimation and change in respiratory pressure. The palpal reflex on thumping or brushing should always be absent, but do not always tap the palpebral reflex. The overuse will eliminate this reflex. Some of the anesthesia monitoring limits. Heart rate should be less than, if it is potentially life-threatening, if it is less than 24, MAP is less than 60, respiration rate is less than 4. So this is a life-threatening values. You have to be cautious, decrease the volume, increase the fluid, right? Start the oxygen. Then evaluation of the cardiovascular system. So see the peripheral vessels. If they are dilated, that means the animal is in the shock. See the CRT should be 1 secondary perfusion. If it is not there, then animal is in hypertensive condition. ECG, BP, and capnography again. The addendum is always there. So good recovery is not difficult to achieve, but however, it is difficult to ruin one inadvertently. How the good anesthesia can convert into a poor recovery, which is otherwise, if a good anesthesia is there, always a good recovery. But how to ruin it? If you are rushing the patient at it is regaining consciousness. Startle the patient with sudden noise. Sit on the neck and talk. हॉस्टल में जाके बात कीजिए and don't talk and sit on the neck, and repeatedly you are lifting the towel and seeing the eye and thumping the eye. Then you wait too long and then you try to use this towel to whip it off. You lunge towards the horse as it rises, you try to advance towards them using the head instead of the tail to study the horse. Tail should be used to study the horse, not the head. Okay. This is the recovery of the xylogen and xylitol anesthesia. See, same animal which has been induced. See how beautifully the animal has stood up without staggering and without struggling. So xylitol, another drug which has to be considered in your armamentarium. So this is the tail-assisted recovery. We are catching hold of the tail and making the animal to stand up. So the longer the procedure, the more important it is to let the animal sleep off. If your induction of anesthesia were not smooth, you let the animal sleep it off. Rule number 1 is let the animal sleep it off. Number 2 is let the animal sleep it off. Number 3 is let the animal sleep it off. Don't try to wake him up. And if the patient is moving his ears to follow sound, that means animal is recovering. Swishing its tail, using his legs to get flies off his belly, that means animal is in the recovery phase. Quality check for nystagmus if it is absent. Allow him to go into sternal or to stand up. Don't rush from sternal to standing. Don't make the animal to go into the standing from the sternal. The longer they lie sternal, the more likely they will have a beautiful recovery. Right? When the animal is in a sternal recumbency, you wait till the animal musters the courage to stand on its own feet, regain its own feet. So this is how you keeping them down, sometime if you want the animal to restrain in the recumbency, your hand should be towards the nose knee on the neck and on ball. So I'm not putting my knee here. I'm always on my ball of the foot so that if animal gives a jerk, I should be able to run from here, right? This is keeping them down method two. Catch hold of this angle of the mandible, one hand on the ear, knees on the neck, and your foot is like that. So if animal, struggles, immediately should be able to stand up. अब यहीं पे if you are sitting palathi मार के and you are sitting with your bum on the ground, animal will trample you up. This is the tail assisted recovery. You can catch hold of the tail and make the animal to stand up. So this was all I had to say. This is the video, which is, in which the animal is being anesthetized, and it is with the help of the pulley, it is being taken to the OT, and the anesthesia machine would be fixed here. This is how the animal is being, restrained on the table. And this is how the animal, once it is being recovered, it is taken from the trolley to the recovery room here for the recovery. The animal was operated for the colic here, right? So that is from my side here. So I finish here, Kritika.
Thank you very much, sir, for such an insightful and inspiring session. Your vast clinical experience and practical knowledge have provided us with very valuable learnings that will certainly benefit all of us in our professional journey. We really appreciate your efforts, sir. Thank you again.
Okay. I think if somebody has a question, or let me see. Inbox here. Inbox, I have a chat box. You can put your questions here. Sir, what advice would you give to veterinary students who are learning equine anesthesia for the first time? Oh, that's a good question. So be courageous. The vets should have more RBCs and WBCs. That means the rough blood cells and the wild blood cells. Okay. Should not be adventurous, should understand the psychology of the animal. You should be stooping down. Don't make ego with the patient. Your closeness, your body should be touching the patient. There should be a very less fear and flight distance, the animals, they judge. So if your body is touching the animal feels your proximity, and you feel that the animal and the handler, they are in a safe zone. What emergency drug should always be available during the equine anesthesia? Yes, you should have the dexamethasone, you have the nicotinamide, you have the adrenaline, right? You have the doxaprem. Then if you are using azalagine, you should have the antacozil. If you are using the medetomidine and detomidine, you should have the etipamizole. Then lots of the fluid and the oxygen. Okay. Then if you want to counter the intraoperative bradycardia, you can use atropine sulfate also. You should not be using the atropine sulfate as the pre-anesthetic, because it makes a viscous mucus plug. So that's why, unlike dogs, we do not use atropine pre-operatively, but intraoperatively, yes, you can use. Sir, during equine anesthesia, which induction protocol do you consider the gold standard routine clinical practice? Well, Himanshu, I would say xylazine and ketamine is the best, right? But if you have used the xylazine and ketamine, I would always encourage you, if it is costly, if economy is not a issue, then you can try the butorphanol, xylazine, and zolotol combination. That also works very well. So Brijesh asks, if we use xylazine and ketamine for induction, can diazepam and ketamine be used for maintenance afterwards? If yes, what are the recommended doses and the diazepam to ketamine ratio for maintenance of the anesthesia? Well, exactly not the diazepam, but you can make a mixture of the xylazine, diazepam, and the ketamine. Or if you are using only the diazepam and only the ketamine, then see, if you want to give more and more diazepam, it won't suffice your purpose. I told you the xylazine 25%, one third or one fourth of the dose you are using, that is ketamine, and 50% of the xylazine. Mix them. So let's say if it is 1.5 ml of the xylazine, that is 100 milligram per ml, use ketamine 3 ml and give to the ant for the maintenance purpose. It's as simple as that. Don't keep on repeating the diazepam. Diazepam initially after giving the xylazine is very, very important. Okay. So we are not using in that purpose. Sir, why anesthetic requirement changes according to the patient? Yeah, this is a good question. See, for lateral recumbency, one lung is working properly, the other is not. There is a hypoxemia. Hypoxemia leads to metabolic acidosis. Right. There is a reperfusion or vascular disturbance also. There is a hypotension also when the animal is in recumbency. The more hypotensive and less perfused animal is always in the dorsal recumbency, because viscera is putting pressure on the caudal vena cava and the aorta. Right. So whole of the vascular system is compromised. So in that case, drug is trapped. You need more of the anesthetic dosages for a safe anesthesia during the dorsal recumbency than the lateral recumbency. Sahil is asking, how can recovery quality be improved? Using a correct induction dose, maintaining it properly. And if it is a violent recovery because of the rigidity being caused by the ketamine, use xylazine. Use xylazine. Don't shy away in giving xylazine in the recovery period. That will smoothen the recovery. And other 3-4 things which I've already told you: don't rush towards animal, don't sit and talk, don't make the animal, don't force the animal to stand up from the sternal or from the lateral coming to the sternal. Do not disturb it. Do not use towel or anything else, or doing voices like this. Do not do that. Hello, sir. I'm a student who is towards the end of third year. I really want to get into equine medicine. How do I get started? You first finish the degree, right? And then you choose the colleges where the equine medicine is very good. I must tell you that the Gadwasu, because of coming up of lot of the stud farms, they are getting a lot of the cases. I was few days back with the head of the department of the surgery department of Gadwasu, Dr. Arunanand, who is a very prolific equine practitioner. So if you want into the clinical equine medicine, I think Gadwasu is number one. Arun is asking, adverse effect of xylazine are during recovery, but as suggested by you, xylazine can be given 1/4 initial dose possible. Yes, it is. It is. Adverse effect of xylazine in recovery means when you have overdosed the animal. Okay. When the effect of the xylazine has gone and the ketamine is yet to be titrated or eliminated, in that case, you will find the rigidity. Okay, but if you are finding a cardiovascular depression, why the hell on the earth you want to give xylazine? No, in that case, xylazine should not be given when there is already depression of the respiratory and cardiorespiratory rate. It is only to smoothen the recovery because of the muscle rigidity, you have to give the xylazine. Sir, how can, Shailesh is asking, sir, how can we know the stage of the anesthesia during the maintenance of, maintaining the anesthesia? Which stage you are talking about? First thing you must understand, stage is nystagmus should not be there. A respiration rate should be very, very stable, right? All the limbs should be touching the ground. Animal should not have increased respiration rate because of the surgical stimulus, right? The heart is well within the limit. It should not be less than 24 beats. BP should be normal. The respiration rate should not be less than 4. That defines a good plane of the anesthesia. CRT should be okay. GPT should be okay. GPT is gingival perfusion time. Himanshu, do you routinely combine local or regional anesthesia with triple dip to reduce the total anesthetic requirement and improve cardiovascular stability during prolonged procedure? Well, regional anesthesia is only being used in the limbs, right? not always. Yes, if limbs are being operated, then we can use the local anesthetics. That will reduce the triple dip requirement. Pervez Khan, in horses, hypotension during general anesthesia is a major cause of postoperative complications. How do you decide whether to manage the hypotension by reducing anesthetic depth, administering fluid, or using vasopressors? And what parameters do you consider before choosing each approach? Well, Pervez, the only thing I should always be keeping in mind about the hypotension is check the CRT, check the GPT, right? If there is a hypotension, the only thing I would prefer is you can either go for a bilateral fluid administration. Okay, so fluid administration will offset the hypotension. It will offset the hypotension, right? Then you can use the drugs like adrenaline or dexamethasone to improve the perfusion. Okay, so nothing very concrete, but hypertension को avoid करने के लिए I would prefer that when the surgery is in the dorsal recumbency and you've almost put the colic operated intestine together, please bring the animal back to the lateral recumbency, right? Do not make the animal to lie down for a longer period of time in the dorsal recumbency. That will worsen the hypotension. Okay, or decrease the surgical time. Oh, a lot of questions. So, doctor's iPhone. Sir, could you please tell me which general anesthesia GA cocktail is commonly used for veterinary surgeries when I've already told you this is Zalagin ketamine. No? Is etomidate suitable for GA? No. Etomidate is for the small animals. Why thoroughbred require higher doses of the anesthesia? Well, thoroughbred require the less dose, because they are trained animals. The more the training, you require less dose. Use of DMSO in veterinary field, especially in equine sports. This is not related to the topic here. Yes, you can use DMSO in colic as well as in the swelling. Sir, for a highly aggressive mare for a routine gynecological examination, would you prefer anesthetic? Yes, I would prefer Zalagin by IV route. And the best standing sedation, the drug which is approved for the standing sedation is a Ditomity. Udbita sir, do you have videos of local anesthetic infiltration for lameness evaluation? This is again out of context from here. You'll find it on the web. Okay, so that finishes the questions here. I think when you're into the practice, you learn the things, you commit the mistakes, and then you see, then you improve yourself. But let us not create mistakes, and mistakes it would lead to a blunder. So from my side, I think everything is being addressed. So all right.
Thank you, sir.
Yeah.
Thank you everyone for your active participation and thoughtful question. I will now proceed with the vote of thanks. On behalf of Indian Society of Scientific Education and Farmer Welfare, ISS EFW, I express our heartfelt gratitude to our esteemed speaker, Dr. Adarsh Kumar, for sharing his invaluable knowledge and experience with us today. Our sincere thanks also goes to Dr. Kritika Ma'am, the organizing committee coordinator, media team, volunteers, and all participants for their support and enthusiastic participation in making day 2 of ISS FEW Equine Summit 2026 a grateful success. Thank you all for joining us. Have a wonderful evening, and we look forward to meeting you again in future ISS FEW academic event. Thank you.
Thank you so much. Thank you.
Thank you, sir, for being here.
Okay.